Hello everyone, this is Dr. Garima Sachdeva, and today we will be studying about incorrect use of other contraceptives. In the previous lecture, we studied about incorrect use of combined hormonal pills or combined hormonal contraceptive. In here, we will be studying about the incorrect use of progesterone only pill, which include both Cerazette and desogestrel. We will be studying how many hours do we say when do we call it as missed pill. Also, we'll be discussing about implants, the incorrect use or misplaced implants, copper IUCD and LNG-IUS, incorrect use, and in case the thread is not visible or the thread is not felt, or misplaced copper IUD or LNG-IUS, how do we manage? So stay tuned, hope you find it useful.
So POP, like if it's a traditional POP, that is Cerazette, then we consider, like even if it is missed for 3 hours, okay, or desogestrel 12 hours we consider. So total, if it's a 24 hours day, then 27 hours since the last traditional POP and 36 hours after since the last desogestrel pill. Okay, if she has missed the pill, then UPSI or barrier failure or before the efficacy has been re-established, because 2 days it takes for it to be re-established. So for missed POP, what emergency contraception you can use? You can either use copper T up to 5 days after the last UPSI, or POP if you have to use an oral one, then it will be LNG, because UPA effectiveness will be less. So this is the same thing like CHC. This interval you should remember. For traditional pill, when do you call missed pill? If it has been, the time frame has exceeded more than 3 hours. And for desogestrel, if the time frame has exceeded more than 12 hours, then you call it missed pill. Then POP, late or missed pill, and then copper T up to 5 days. This is the same thing as the previous flow chart. You can give LNG, effectiveness of UPA will be less. Then for DMPA, when do you call if it has missed? If you do not give the next injection, even after 14 weeks, okay, and return of ovulation is 15 to 49 weeks, then either you can, as an emergency contraception, either you give copper T, you do not give UPA, because again it's a progesterone, you give levonorgestrel if you have to give an oral one.
Okay.
Then DA, this is also the same thing. Then implant, this you should remember. Implant, as soon as you remove the implant, and the ability to inhibit ovulation is lost, so the ovulation can return immediately. So for that, I told you that DMPA, so you put it like you give every 12 weeks, so even up to 14 weeks it was effective, right? Same with CHC, up to 48 hours. But for implant, this is not there. So today, if you have removed, then if the next day, or if the implant is effective for 3 years, if 3 years are over and it is 3 year 1 day also, then also you will require if she had a UPSI on that day, then also she'll require an additional emergency contraception, and in that case copper T or levonorgestrel you give, because again it's a progesterone. Okay.
Yes, ma'am.
So this you should remember, that immediately after removal of the implant or its duration is over, the ability, its contraceptive efficacy is lost. So you have to immediately give an emergency contraception or additional contraception. Then if there is this is the same thing, recently removed implant, you have to either insert copper T, levonorgestrel, copper T up to 5 days, and levonorgestrel up to 3 days, and UPA, the effectiveness will be less. Then levonorgestrel IUS, again copper T can, like if you have to give an emergency contraception, levonorgestrel, if it has been removed, either you can offer a copper T up to 5 days, or in this case again you cannot give ulipristal, because it's a progesterone, and oral, if you have to give, you give LNG. So this is the same thing. And ovulation could have occurred at any time prior to or after removal of LNG-IUS, because it was basically inhibiting fertilization and implantation. It was not having major effect on ovulation.
Ovulation.
Okay. So then if copper T is post removal, or if it has been accidentally expelled and UPC has been within 7 days before to the removal of IUD, then you have to give emergency contraception. So suppose you remove a copper T today, then and she had a UPC 7 days prior, then again you have to put a given additional emergency contraception. And choice here will be either you replace it with another copper T, or you give UPA if this is about copper T, because if it's copper T, then you can give UPA also if UPC has been within 5 days. For LNG IUS, you do not give UPA, you give LNG. Understood? Yes, ma'am.
So you are repeating the copper T again, ma'am. Suppose
this,
if it got expelled.
Yes. Removal or expel. This is the same as the previous one.
Okay.
Then
Okay.
okay. So this is for copper T. For copper T, like UPA can be used because it is non-hormonal. Okay, but for LNG or other things like other progesterone CHCs, you do not use UPA. Okay, so this was about the incorrect use of contraceptives.
Hope you found it useful. Thank you so much for watching.